the scope of my work, the title that I've given it is actually caregiver communication. And with research, it could be feast or famine. And right now, it's a little bit of a feast for me, and I'm in a happy place. To get funding, what I'm doing is taking my caregiving research to the next level in terms of developing an intervention. And I'm starting out with student nurses over at the University of Manitoba. I received some pilot money to fully develop the intervention, to study it a little bit more, to tweak it so that when our CFI-funded lab over at Grace Hospital is built, I can apply for more money, for larger sums of money. But what we're trying to study is, first of all, to draw on Alan Katz's work on computer risk assessment. What that tool will involve is actually people who present themselves to the primary care clinics are just sitting there, and sometimes it's for a long period of time. Now, if you present yourself for an annual review, it would be really good to get people begin thinking about some of their unhealthy behaviors. And he's developed a computer risk assessment tool that can be used in the clinic setting. And once the patient has gone through that tool, they will print it. And when your name gets called, you will present yourself to the GP with your list of behaviors that could serve as a stimulus for discussion. I learned about this exciting new tool, and I thought, why don't we merge our research together? So in terms of empathy, you always have to have something to talk about. And as I've been speaking to you, some of these behaviors are pretty easy to judge. So why not take my empathy intervention, teach it to student nurses, they will practice it for 2 weeks, and they will come back in 2 weeks' time, invite family caregivers to also complete that risk assessment tool, present it to the student nurse, maybe pick one behavior that they want to change. The student will have already practiced empathic dialogue. We will videotape it and then play it back to the student nurse so that they can identify where they felt they should have recognized thoughts and feelings that the caregiver was trying to relate to them. And, you know, people may feel this is, maybe they're doing it somewhere else, maybe to a certain degree, but the uniqueness comes from merging different bodies of research together and moving towards supporting family caregivers and their health behaviors. And it's by using innovative tools that we have not used here in Winnipeg. I don't see it as being done anywhere across Canada.